Truth about waist trainers. Here's what you need to know. So waist trainers, I think, came into existence. I started seeing it on social media probably about 5 years or so. Interesting concept. You see women on social media wearing them and their waists are super small. And I was like, oh, that's kind of interesting. And it kind of looks like a corset. And that's basically what it is. That's kind of the less extreme version of a corset. Hundreds of years women were wearing corsets, and the idea was for aesthetics that they wanted a really, really small waist. And so they wore these kind of these bands that go on their waistline, and they tie these strings and really, really force these waists down to really, really small proportions. Some women take it to the extreme. They actually remove some of the ribs to make it even smaller. But we're not talking about that. I want to focus on the physiology and anatomy of what waist training is. So if you look at the corset training, what you're doing is you're squeezing the rib cage down. You're warping the bones of our rib cage. We have a couple on the lower aspects of our rib cage, T11, T12, and they're floating ribs. And so what you're doing is you're putting a lot of pressure over time, and you're getting those bones and cartilages to warp down. And so you get a smaller rib cage on the lower part of your rib cage. But at the same time, what you're doing is you're squeezing your organs inside your abdomen. And it's like squeezing a balloon. It has nowhere to go. It can't go out the sides anymore, and it can't go out to the front anymore because it can't squeeze. So where does it go? It goes up, and then it goes down. So it kind of goes up into your chest cavity, so it's a little bit more difficult to breathe. You breathe a little bit shallower most likely, and then maybe you get a little more pressure on your lower abdomen and your pelvic area. Makes you want to pee a little bit more, I would think. But that's just the concept of what you're doing when you're squeezing the waist down with a lot of pressure. And then hence, now you have waist trainers, and that's, this is an example of a waist trainer. This is actually my waist trainer I developed for my patients after surgery. And so it's a less extreme version of corset training. But waist training was mostly designed, I think, as we know now, it's mostly for exercising and just helping women to have a smaller waistline. And it's this misconception that you're going to have a smaller waist permanently by wearing waist training. It is not true. That is such a lie. You're not training your waist to be small. It will never be that small forever. Temporarily, yeah, your waist is a little bit smaller while you're wearing it. Maybe for maybe 30 minutes to an hour after you've worn a waist trainer for 3 or 4 hours, maybe it's a little bit smaller. But the reality is your rib cage and your cartilage will pop back out, and there you go. You go back to normal. And then women might be frustrated. Oh, I need to wear a waist trainer longer. So yes, it's smaller during the time you're wearing it, but it's not a permanent change in your rib cage or your anatomy. Your body wants to come back to normal. It's not designed to be squeezed in your abdomen. So women who are using waist trainers to have a permanently small waist, you need to kind of get over that. It's not true. It's not going to happen. It just won't. I'm sorry to tell you that. Leading into exercising and training, I believe that waist trainers do support women's abdomen. It supports the abdomen more effectively than you see traditionally with weight belts that the guys use. So those are not really, in my opinion, designed for women. What's, I think, more physiological for women is you wear a waist trainer that supports your entire abdomen, because anatomically women are a little bit different than men, especially so after having children, where naturally they have a little bit of separation of abdominal muscles and they have a little bit less abdominal tone. So having a little more abdominal support during heavy exercise, specifically weight training, I think is helpful. I always have my patients after surgery who are interested in exercising with weights. If they have body contouring specifically of the abdomen, either be a tummy tuck or liposuction, I encourage them to use a waist trainer only during their training. And that helps a couple things. First of all, it gets them back in the gym sooner, which is a good thing. Gets the circulation going. And again, they're going to be supported in the midsection. They're not wearing their garment, which I have them wear for 2 months. They're only wearing a waist trainer while they exercise. A lot more comfortable to wear a waist trainer versus wearing a full garment. My experience with the waist trainers previously is that they are designed to make you sweat, which after surgery is not a good thing. Physiologically, after surgery, when you're doing body contouring such as tummy tuck or a liposuction, your skin and soft tissue is not healed yet. It's not normal. It doesn't sweat normally. It doesn't feel normal. It's numb. It's tingling. After a tummy tuck, your muscles are repaired and need support. So it's important to me, and this is why I designed, the FitDoc waist trainer, is that it's ventilated. It's actually designed to let your skin and soft tissue breathe. So the idea is not that you're sweating profusely. It's not to suffocate your skin and soft tissue. The purpose of this trainer here, specifically mine, is support your abdomen and also let you be comfortable in your early recovery while you're exercising. Anyway, I hope you learned something. It's a great topic. Again, if you like the content, please like and subscribe. Follow me on Instagram, follow me on Facebook and Twitter and TikTok, and hope you learned something. Stay tuned for more.